when it is, thank you. I'll let you all know when it's up on YouTube. So thank you all so much for volunteering for this project. It's really important. And thank you to Tess Ellens from Dane County Public Health, who's doing our training today. I am not going to take up a lot of time because I know we don't have a lot of time. And Tess has a lot to share with us. Basically, the project is to help us disseminate as far and wide as possible the flyers that we have. And the flyers are in English and Spanish, and they basically have FAQs about the vaccine and some information about how to get the vaccine, trying to give some good information and debunk some myths. And after the training, we are going to send out to you a sign up genius, and it has a very long list of possible places where you could bring the flyers, either to hand them out like at a farmer's market, or to bring stacks to a business and ask the business if they would be willing to have that stack like at their cash register or something. So be on the lookout for that sign up genius. And then just the last thing I want to mention before I turn it over to Tess, June 15th from 2 to 7, the Urban League is having a pop-up clinic. It's actually a follow-up clinic from the one that they did last week. So most people will be coming for their second shot. Some people might potentially be coming for their first shot. And I can't be there. I'm going to be on vacation, but I mentioned at a planning meeting today that I would ask you all if any of you are available. They need volunteers just to come at 1 o'clock and to be there to help with, like crowd control and set up at the beginning and help it with cleanup at the end, that kind of thing. So, and it's, I think it's the last slot on the sign up genius because I just added it today. So think about if you're available on June 15th to help out at the Urban League, and it's on South Park Street in their parking lot and inside. So just wanted to throw all that out at you really quickly. Rebecca, did you want to say something?
I do. I just want to clarify about the sign up genius. 2 questions. Number 1, what if somebody comes up with an idea of flyering something that's not on that list? What should they do?
Just let us know where you're going to be and when you're going to be there, and how many flyers you think you can hand out or give out. But yes, absolutely. If there's a place that you frequent and you're like, this would be a great place to hand out flyers, but it's not on the list, go for it. That would be great. Just let us know.
Let you or me know, essentially. Bonnie,
yeah,
or
either of us. Yeah.
Great. And the last thing is, if people want to flyer in teams, would they sign up together on the sign up sheet, or?
Yeah, so that's a question that I had because I only put 1 slot for each thing, except for the Urban League. I put 5 slots. And I think it's nice to go in pairs, and I can change it to be 2 slots for each. I just didn't want somebody to think, oh, if there's only one of us, I can't go. So, but I can change it to be 2 slots for each thing, but just don't think if nobody else signed up, you're the only one who signed up. That doesn't mean you can't go. You can still go by yourself, or recruit a friend to go with you.
Okay, great. Thanks.
Yeah, no, good questions. Thank you. All right, Tess, I'm turning it over to you.
Sounds good. Hi, everyone. Thank you so much for letting me be here. I am really excited to be with you all. My name, like Bonnie mentioned, is Tess Ellens. I use she, her pronouns. I'm the immunization coordinator and a public health nurse with Public Health Madison, Dane County. So yeah, just really, really grateful for allowing the organizers for me to be here and connect with you all. I'm really hoping that this can be a pretty informal, almost discussion. The purpose is really so that you guys can take away information that you think you need when talking to the community. So if at any point you want to stop, ask questions, please feel free. I want this to be useful for you all. And yeah, just it's going to be a lot of information, so I want to make sure it's digestible. So happy to slow down if needed too. So I'll go ahead and share my screen here. so we can do this. Hold on one second. Alrighty, I'm gonna hop over here. So many screens. Okay, let me know when you can all see this.
All good.
Awesome, beautiful. Yeah, like I mentioned, today all about COVID-19 vaccine. Excited that you're all here with me today. So first, the first thing I want to say kind of about COVID vaccine is that my job and your guys' jobs and anyone who's doing COVID vaccine education, I think forgets that sometimes our job is not to convince or coerce people to get vaccinated, right? It's to answer questions that people might have so that they can make an informed decision. That's what most of vaccine hesitancy is about. We understand that some people are nervous about COVID-19 vaccines, and that's completely reasonable. So fortunately, researchers have been working on vaccines in the coronavirus family for a really long time. So this is not like a process that is starting from scratch. So throughout this whole process for developing coronavirus vaccines, they've been really transparent in sharing data, holding live hearings, and pausing trials when it's important to slow down. So all of this shows that we can trust in the process of vaccination. And vaccines is really just a critical tool in our toolbox for making sure that we can get rid of COVID, in our communities. One thing I always tell people too when I'm chatting with them is that, we've sacrificed a lot over the past year and a half now we're at. And you guys doing this work, I just want to express my gratitude because you guys are just taking that extra step to keep your community safe, keep your family, friends, up to date on what's going on. So I always say that by staying up to date on information, we can make sure that we're as healthy as possible. So today we're going to kind of do an overview of the vaccine development, authorization processes, safety. Then we'll talk about distribution a little bit within Dane County, meant to touch on health equity there, and then kind of go through some common concerns or questions that you all will likely hear while you're out doing this work. I'm hoping the common concerns, again, like we have a small group, which I actually love. It's a little bit more interactive. I'm hoping to kind of ask the question during common concerns, and people can either type in the chat their answers, unmute, things like that. And want to reiterate that this is a safe space for us to kind of ask questions and learn from one another. So no shame at all about answering something wrong or asking a question you think is silly. No such thing as silly question. So first, an overview. So what I think a question that a lot of people ask is kind of, what is the COVID vaccine, right? So, vaccine is a really important public health measure that is helping us get out of the COVID pandemic. We currently have 3 vaccines that are currently authorized for use in the United States. There are 2 types of models of COVID vaccine that we have available for us here in the US. So one of them is an mRNA vaccine. That is the Pfizer and the Moderna vaccine. And then we also have a viral vector vaccine. That is the Johnson & Johnson vaccine, or also known as Janssen, but it looks like Janssen. So for the mRNA COVID vaccine, so again, that's Pfizer and Moderna, they use a small strip of genetic code that's called mRNA. That's why they're called mRNA vaccines. This is a code that basically is instructions for your body to learn how to make the spike protein that we see that picture of coronavirus with all those spikes on the outside. mRNA vaccine basically is instructions that we hand to our cells to teach them how to make the spike protein to create antibodies for COVID vaccine. So once your immune system recognizes the spike protein from the mRNA vaccine, it makes antibodies, which then fights the COVID infection. For the another thing for the mRNA vaccines quickly too, your body destroys that mRNA from the vaccine within a few hours after you get vaccinated. So it degrades really quickly in the body once you get the vaccine. There's some confusion about mRNA, and we'll talk about this a little bit later, how mRNA impacts your DNA. So keep that in the back of your mind. That's a question I'm sure will come up later. For the viral vector vaccine, so that is the Johnson & Johnson vaccine, again, also known as Janssen, that uses a different kind of vaccine model. So that is a modified version of a different type of virus and not the actual coronavirus to help deliver important instructions to our cells. So what happens is basically the vector, that's why it's called viral vector vaccine, basically is like the messenger. It enters the cells in our body with the instructions of how to make antibodies to the coronavirus. So the way that I describe the two types of vaccines, for mRNA vaccines, think of it as a mailman that's hand delivering your mail to you, and that mail is instructions. So basically, mailman's delivering the instructions to your cell, gives you a warm handshake and hands that off. The viral vector vaccine, again, Johnson & Johnson, I think of that as like a Trojan horse to get that information inside the cell, and then your cell knows how to make it. There's nothing wrong with either one of those. They're just different types of vaccine models, and they both work really, really well. So that's kind of a way to keep them separate. Again, I think it's really important to reiterate that vaccines cannot give you COVID-19 infection. It's just something that I know a lot of people think that with vaccines that we're injecting live virus into the body for COVID, and that's not the case. Any questions on that quickly before I keep going? Okay, cool. So I think it's really important too to talk about vaccine development. The reason is that, as we all know, COVID vaccines were developed very quickly. That's not for lack of skipping any steps though. So I wanted to kind of go through all of the different phases that still occurred in each and every one of these COVID vaccine clinical trials. So all of them need to, all vaccines, regardless if they're COVID vaccine or not, go through 4 phases of development where people actually volunteer to help researchers determine if the vaccine's safe, what the right dose is, and if there's any serious side effects. So this starts with a phase 1 study where researchers will give the vaccine to a small number of people. This is usually 20 to 100 volunteers to see if it's safe. Then we move, once they kind of figure out that the vaccine is safe and make sure it works, we move on to phase 2. That has usually hundreds of people. Again, all volunteers to see if it works in a larger scale, right? Then once again, it works out pretty well, they'll move on to phase 3. Each and every one of the COVID vaccine clinical trials for the 3 vaccines we have authorized here had at least 30,000 participants for each clinical trial. That's a lot of people. And again, those are all volunteers. So during phase 3, they're really testing for safety and vaccine efficacy. If the FDA then approves the vaccines after phase 3, we then move into this phase 4 trial, which is post-authorization or approval from the FDA, but this is long-term data gathering. So I think there's a common misunderstanding that vaccine safety monitoring stops once the vaccine is approved or authorized. But it does not stop. So we'll continue to monitor for safety signals, make sure that the vaccines, any side effects are still being reported, and they will continue to gather that data to make sure that we're learning about long-term side effects and what kind of trends they're seeing. So again, just to reiterate, the COVID vaccine process moved really quickly in the administrative part, and that's because we had a lot of funding and a lot of entities working together at the same time for a common goal, but no research phases were skipped. So each one of these, 1, 2, 3, 4, they all still occurred. Any questions on kind of the vaccine development process? Yeah.
Yeah, this is Mary. I have heard from some of the skeptics in my family that, of course, the emergency authorization was like skipping a step.
That's a great question. And actually is my next slide. So can you hold tight on that for just a second while I answer another question and then we'll talk about it?
Yep.
Awesome. Thank you. Was there another question?
Yes, my question is that another thing that I've heard is that they skipped animal testing, which is problematic because with animal testing, you could see long-term effects quicker, say in mice, right? So, I know someone who's not getting vaccinated because they're like, I'm not going to be a mouse.
Interesting. Yeah. So it's a great question. The way that I would usually respond to something like that is that there can be a really big difference between animal responses and human responses, right? And I think it's important to note that with the time frame that happened, like with these types of vaccines and how fast it was impacting us human beings, it was really important to make sure that we were working with human volunteers who are willing to get this going a little bit faster. When they will talk about animal trials with vaccines or medications or things like that, usually those are very helping us gain a very basic understanding of what some of the effects of the vaccine is. But that's also really limited, right? Like if I give, say, a mouse a vaccine, I'm only going to learn within the mouse's system and body what kind of response it will have. And so I think that, like for some vaccines, they will test that for a long time in animal trials. For mRNA vaccines, though, I think another really important thing to mention, that is a brand new type of vaccine. And it's not like something we've ever seen before. And it's, I think, going to really revolutionize how we think of vaccines. The reason why mRNA vaccines especially don't have to be tested on animals is because we basically just need the genetic code for the disease. And then, like I mentioned before, we basically hand the instructions to the cell. We don't really need animals to tell us like how that works best to be handed to the cell. We know what the code and sequence is. Sometimes there's a little bit of a guessing game when it comes to animal trials, and we just didn't have to do that with this. That was a long-winded answer, but did that answer the question? Okay.
Thank you.
Yeah, the other thing too is the viral vector vaccine that Johnson & Johnson, that's a really well-established vaccine model, right? So that has been one that's been studied on animals a long time ago. So again, they know that both of these vaccine models work. Yeah, great questions. Other questions on this quickly or slowly? We can go as quick or slow as you want. Cool. Well, we will hop into the next question about vaccine authorization. So this is, I think that was a perfect segue into my next slide. So I think it's really important to distinguish that, and we need to be kind of careful with our language of how we're talking about it. So we don't have any vaccines in the United States that are fully approved. We have some that are authorized by the FDA. Mm-hmm. The difference is that an emergency use authorization, this is a specific type of authority by the FDA to allow use of certain medical products to make sure we're preventing serious or life-threatening diseases when safety criteria are met and there are no alternatives. That is a really big difference between full approval and an emergency use authorization, is that there's no alternatives. So when an emergency use authorization is submitted to the FDA, it still includes safety data from phase 1, 2, and 3. So all of that still stays the same. In addition, the phase 3 data includes follow-up for at least 2 months after participants receive the second dose. So there's still a prolonged amount of time that we're watching in an emergency use authorization. It doesn't have anything to do with skipping any of those steps. It basically is just the lack of other alternatives, and also like for a full approval, we tend to watch vaccines in that phase 4 stage a little bit longer. But still, all of these vaccines were followed for at least 2 months after the second dose for all participants. Does that answer the question that you had about emergency use authorization versus approval?
Yeah, I don't think that that will convince them, because of course it is still an emergency use. But I thought I heard on the news like yesterday that Moderna is ready to apply for full use.
You're absolutely correct. And Mary Bell, I'm just like setting you up. It seems like I'm just like pitching you what I want you to talk about next for me. It's working beautifully. Thank you. You are absolutely correct. So we are now in a place where we have 3 vaccines that have an emergency use authorization, which is great. And they all offer slightly different things, right? So we knew the Pfizer vaccine was able to go down to age 12 now, which is really great. The reason why we were able to get 3 COVID vaccines under an emergency use authorization was because the limited quantities of vaccine and how fast we needed to get out. So when we say there's no alternatives, there wasn't enough Pfizer vaccine to vaccinate every adult in the United States. So that's a limited or no alternative situation. So we are at a point where now we have been able to monitor in that phase 4, again, continue to monitor those side effects and kind of long-term impacts of that. And so Moderna is working on submitting for a full licensure. It's called a BLA, basically full licensure for their vaccine. That would move them out of an emergency use authorization and into full approval. Pfizer is also working on the same thing right now, and Johnson & Johnson is too. So similarly to early in the pandemic, when it was like, which vaccine is going to be out first, we're kind of in that again, where we're kind of curious to see which vaccine will be fully approved first. We're expecting that we'll have 3 fully approved vaccines, probably by the fall. I wouldn't be surprised. So that's great news, and hopefully convinces some of those other folks that are a little bit more hesitant. Like, I don't like the fact that it's emergency use authorization rather than full licensure.
Right.
Yep. Other questions on the EUA or the licensure?
This is Leisha. Hi. I had my hand up, but I don't think I don't know how it works. So I will lower my hand, but it's for the animal testing real quick. I just wanted to make a quick comment. I work at Covance. I'm in the phase 1 clinical trial. So like first in human and all that. I just want, the animal testing was done on Moderna and Pfizer. The issue was that it's not really even an issue. Typically we do work on like cynomolgus monkeys, etc. and stuff. I don't do any, I only test on humans. I don't touch the animals. I love the animals. But but that department, we usually will test or all drugs are tested on the animals first and then go into first in human. That's the sequence. And the only difference is with Moderna and Pfizer with the vaccine is they tested simultaneously. So animals have been tested at the same time as humans. Usually the animals go first and then the humans, but they just didn't do it. They didn't do it in sequence. They did it simultaneously. So there is information out there on how animals reacted, but at this point, let's just look at, we see it's working on humans. So
yes. Thank you for clarifying, Leisha. I really appreciate it. And that's super helpful to have that. The information that I had, I think it's because it was mixed in that, like it was happening simultaneously, so it didn't happen first. Correct. So thank you for clarifying. I appreciate it. Cool. And it's like a helpful insight to have. So
yeah, exactly.
Anybody else's hand that I don't see that wants to unmute? Yeah.
I have a question. Are there any other examples of like vaccines or medications that were emergency use authorized that people might know of that just would be like helpful to name?
Yep. So that's a great point. So early in the COVID response, there was 2 medications that were approved or authorized for use under the emergency use authorization. So that was I always mess up the name, banalinavab was one of them. And then the other one was, man, the name is escaping me now, but I can get it to you and I can drop it in the chat. So our first COVID medications that helped save many, many lives were also emergency use authorized medications. So same thing happened in H1N1. For that was that was a brand new type of flu vaccine that had to happen pretty quickly. So we have to use that in limited situations when we're trying to save lives as fast as possible and we don't quite have the luxury of time.
Mm-hmm.
Yeah.
Thank you.
Yeah, great question. Other questions? And yes, so sorry, I can't see all hands raised, so feel free to unmute if you have a question. Okay, we'll keep going. So I think another really important thing to mention is that, what I said before is that all vaccines go through 4 phases of development where people volunteer to make sure that researchers can determine if the vaccine is safe or not. So just to reiterate, no corners have been cut in developing a safe and effective COVID vaccine despite the high speed of development. So all of these vaccines still needed to go through the institutional review board to make sure that all the rights and the welfare of the folks that were participating in the study are protected. So we have tried to make sure within the United States and abroad that governments are eliminating the financial barriers that would slow down vaccine testing and production. And together, scientists from around the world were able to build on decades of vaccine knowledge to make this process speed up. So again, no people's rights were violated in this. It was a lot of volunteers that just wanted to help get out of this pandemic a little bit faster. I think another thing that's important to mention is that there was a really big commitment during the COVID vaccine rollout that I haven't really seen in other vaccine trials before, which was a commitment to health equity and ethnic and racial diversity in the clinical trials. Something that historically pharmaceutical companies have not been great at is making sure that the folks that are participating in clinical trials actually reflect the population, right, that we have within our government. So in all the trials, the vaccines were found safe and effective. And like, for example, in the Pfizer vaccine, about 42% of overall and 30% of the US trial volunteers were non-white. In the Moderna trials, people of color made up about 37% of the volunteers. And for J&J, 13% of people were persons of color. More specifically, when it comes to race, Pfizer and Moderna actually released a report that broke that down a little bit more, that said nearly 10% of folks that identified as Black and 20 to 26% of people identified as Hispanic or Latinx in the clinical trials. So again, trying to make sure that we're sampling a good proportion of who we're getting vaccine to, but in a way that's not coercing, in a way that's using volunteers. I think that's a really important thing to recognize. So next, talking about distribution. So I think a question that I hear a lot is, how has vaccine been distributed in Dane County? So first and foremost, data really drives where the vaccine goes. So early in the pandemic, vaccine was distributed based on population size. So Wisconsin makes up 1.8% of the population of the United States. So we got an even 1.8% of all COVID vaccines from the federal level. So it was really kind of clear cut at the beginning of population size. As things have progressed, we have been using census tract data, municipality data, to try and ensure that we're getting vaccine into places that have lower vaccine rates. So that has continued to be the case throughout this whole pandemic. DHS, or the Department of Health Services in Wisconsin, has tried to make sure that counties or areas that have lower vaccine rates get a higher proportion of vaccine. so that we can make sure that those places are getting vaccinated. This also goes though for not just geographical location, but again, racial ethnic groups that have lower rates of vaccinations, i.e. the Black and Latinx community, are, you know, getting vaccine in an equitable way and not just a clean cut of, you know, like the state of Wisconsin got. We're trying to use race ethnicity data to also drive how we're getting vaccines. Next, we've been trying to make sure that we have really large throughput sites. As everybody knows, there's huge demand for vaccine once it first came out, right? So we've really needed to open these really large drive-through sites to get a lot of people in a short time. That's not usually the norm for vaccines. We like to do those in a clinic setting, but trying to make sure we get as many people done in a short amount of time. Also, I'm sure some of you have heard, and what was talked about earlier on the call is that mobile vaccine clinics in communities that have barriers to access, trying to get out, again, using that data to see neighborhoods that might have lower vaccination rates and trying to figure out where we can go into communities so that we can just eliminate those barriers to access. We recognize that not everybody can get to us. So how do we make that happen? And last but not least, clinics and pharmacies. That involves, you know, pharmacies are pretty much in everybody's neighborhood. Usually each neighborhood will have a pharmacy. And so the Department of Health Services have tried really hard to make sure that all pharmacies in the state of Wisconsin had COVID vaccine and clinics as well. We recognize that as we start to move out of these large throughput sites, that we want to make this a part of our normal, for example, flu season or things like that. We just want to bring COVID vaccine into our regular vaccine. So you'll probably start to see more COVID vaccine moving into clinics. So where could I get COVID vaccine in Dane County? We are really fortunate here within Dane County that we have a lot of options. So first, you can look at our Public Health Madison Dane County website. You can see actually here is a screenshot. We have mobile clinics at all of these pins. So we will update this whenever we get a new confirmed mobile vaccine clinic. If you click on one of these pins, you'll see the details of the site, the time, and all of that sort of stuff. So that's one avenue. We also have the Alliant Energy Center that will be open through the end of June. And then we'll be in our clinic spaces at Public Health Madison Dane County, our South Madison and our East Washington office. But you can also look at things like vaccines.gov. That's the vaccine finder. That's really nice. You can just put in your zip code. For example, for this one, I put in 53713 and within 25 miles. These are all COVID vaccine providers. I would be wary. This is a piece that I gave feedback to DHS about. When something is listed as out of stock, that has to do with self-reporting from the site. So the best way to always see if a site has vaccine is to call to see if it's available. But otherwise, you can see that we have quite a few COVID providers here within Dane County, or also your local healthcare provider or pharmacy, like I mentioned before. So quite a few options within Dane County. Any questions? I'll stop the questions quick. Awesome. So current vaccination rates in Dane County. So this is as of yesterday. Right now, current estimates of herd immunity are between 60 and 90%. I know that that's a question that comes up a lot, is what is the level of herd immunity, or what percent of people need to be vaccinated in order for us to be done, essentially? And that's really hard to say, because some of that percentage has to do with natural immunity that people get from having COVID infection. And we don't really know those levels super well. So we have benchmarks that we try and go for. So you can see that that's around 60% on these. So percent of Dane County that has at least one dose of COVID vaccine is 65.8%. Percent of Dane County that's fully vaccinated is 57%. And then percent of Dane County residents 65 plus who are partially vaccinated, so at least one dose, is 95.2%. So these are all super awesome to see. And I don't know if you all saw that there was an article in the state journal the other day that ran a report and looked at CDC data, and Dane County actually has the highest COVID vaccination rates in all large counties over 300,000 in the United States. So that's really incredible. However, we also have some of the highest proportions of racial disparities in that data, right? Something that's not unique to Wisconsin, having some of those racial and ethnic disparities. So as of today, the data that I grabbed is that 50.1% of the Latinx population within Dane County has been vaccinated, those are good numbers, but only 32% of the Black communities in Dane County have been vaccinated. That's a really low number. And so that's an area that we know is a huge gap and needs to do some more intentional work there. And in full transparency, as you all can see, I'm a cis white female, and I recognize that I don't relate to everybody, that we need to get vaccinated in these groups. So it's really important to have trusted community members and trusted messengers like you all and others to make sure that we're listening and having conversations so that we can increase these rates. On that note, health equity and COVID vaccines. There's a lot of reasons why victims of racism, particularly in healthcare settings, are vaccine hesitant. Communities have experienced hundreds of years of systemic and individualized racism in medical settings and experimentation, just calling it like it is. And so it's really important to be mindful of all of this history when we're talking to folks in the community. With the process of development and delivery of COVID vaccines, we're hoping that this is an opportunity to do some reconciliation in that world, but recognize that that takes time. So, these vaccines have been tested on volunteers from many, many backgrounds, including Black communities, Latinx community, Native American, Asian community, and show positive results in all of them. The other thing too that I think has been an accomplishment in this pandemic is how all the governments of the world have really come together to work on this common enemy, so to speak, right? And so again, it's something that we really strongly believe that the health outcomes shouldn't be determined by race, gender, income, or any other status, and that everyone deserves to live in a community that supports healthy living. And so needing to eliminate barriers, whether that's financial, so no COVID vaccine should cost anyone anything, transportation, trying to get more into communities, things like that. So as we're doing outreach work, as you all are doing outreach work, it's just really important to be mindful that even though we're doing things to overcome some of these barriers, that we still have things like universal basic income that's an issue, and equitable school funding that's an issue, eviction moratoriums. So all of these things are important to keep in mind when we're doing outreach. And to name, I think that's just a really important piece too, is to just call it like we see it and listen, right? Questions on that? Okay, so next we kind of have common concerns. So this is part that I'm hoping to be a little bit more interactive, if you all feel comfortable with that. I'm going to put a question up on the screen, and you guys can either type it in the chat. Actually, the chat is kind of hard for me to see. If you feel comfortable unmuting, that would be great. Again, this is safe space. We're all here to learn from one another, and there's no shame in any of these. So let's get to it, shall we? So the first concern that I hear, why do some vaccines have 1 dose and others have 2 doses? Does anyone have an idea?
Is it because of the type of vaccine? So the other 2 is the mRNA, and this one is different. So is that why?
Yes. Yep. So it has to do with the model of vaccine. That's exactly right. And what they see in clinical trials. So part of that phase 2 in clinical trials for mRNA vaccines, the Moderna and the Pfizer, they found that they had higher immunity after getting a second dose, 2 weeks after a second dose. So they're like, cool, that's what we want to see. For Johnson and Johnson in clinical trials, they gave 1 dose, measured immunity and antibody response, and it was enough. Again, it has to do with that make and model of vaccine. And so that's why some have 1, some have 2. You'll hear about other different types of vaccines kind of around the world that have different models of vaccines, and sometimes they require different dosages. So, and again, for the Pfizer vaccine, people need to wait 3 weeks after receiving that first dose, or 21 days, to receive that full series. And then the Moderna vaccine, people need to wait 4 weeks after the first dose. So yeah, awesome. Questions on this one? Cool. How will I feel after getting the vaccine? Raise your hand if you've heard, raise your, I don't know, hand, or whichever, your real hand or your little electronic hand, if you've heard of Moderna arm, or I felt like garbage the next day after getting vaccine. Has anybody heard this? Okay, yes. That's something that we've all definitely heard, right? So I think this one kind of answers itself. How will I feel after getting the vaccine? So just like with other vaccines, you might have some, redness, soreness, or a little bit of warmth in your arm of where you got the vaccine. You might also get a little bit of a headache or fever, or feel tired and achy for a day or 2. That's all completely normal in the realm of vaccines. What those are signs that your body is building up protection and that the vaccine is working. That is just demonstration that your immune response has received the information and is mounting an appropriate response. So these are very common side effects. They're normal side effects. Most people do not get serious side effects after getting vaccinated. I'll talk a little bit more about the Johnson & Johnson because there's specific questions about that in a little bit. I think it's really important to frame this question too when you hear it, like, I don't want to get the vaccine. I feel I can't miss work the next day. To really understand that some people's lives are truly that they can't miss work, right? Because that might equal them missing a meal for their family or things like that. So it's really easy for me as somebody who works primarily during the week to get a vaccine. I have the flexibility of sick time. I have the flexibility of someone to watch my kid if I'm sick. Not everyone has that luxury. So again, if you hear somebody saying like, I don't have time to be sick, that makes sense. And like, we need to just kind of accept that a little bit. And, talking about that, like, yes, it is totally valid that, if you have side effects, you can be out the next day or 2, but then your side effects will go away. Another way to frame that a little bit too is, again, never wanting to coerce people, but just that I think everybody has heard how crummy people feel after COVID infection. We hear about these long-term effects of COVID. And so the way that I talk to people about it is, I would rather feel crummy for a day or 2 than for 3 months. That's going to be much, much harder to kind of get through my day-to-day life. And the vaccine will help prevent that. So questions on this one or other things people hear?
I wouldn't want to make anyone defensive about it,
Mhm.
but I've heard far more people who had no side effects other than they knew they'd gotten the shot.
Mm-hmm. Yes. So I guess the flip side of this that I hear, is I didn't have side effects, so the vaccine's not working. and that's not true either, right? Everybody's body responds a little bit differently, just depending on our own internal immune system. So if they didn't feel side effects, that doesn't mean that they need to go get an antibody test to make sure that they have, enough of the vaccine. We've, in the clinical trials, we studied 30,000 plus people. So now it's actually probably like 90,000 people. And everyone, side effects or no side effects, still have the same level of antibody response. So that does not impact how you'll be able to defend vaccine or COVID in the future. Yep. Yeah. Good point. Okay. Next one. How long after getting vaccinated will I be fully protected? Does anybody know?
Is it about 3 weeks?
2 weeks after your last dose. Yep, so that's pretty close. So for people that receive the Johnson & Johnson vaccine, that's a 1-dose series, you're protected 2 weeks after your first and only dose. For Pfizer or Moderna, you're fully protected 2 weeks after your second dose. Another thing too is that a question that you will most definitely hear is how long is the immunity? How long is the protection? When will I need boosters? And all of that is like a like a little bit of a we're not sure yet, right? At this point, we just don't know how long protection lasts. Once we, again, as we're continuing to get more time under our belts, we're starting to understand a little bit more about how long-term immunity happens. Anecdotally speaking, coronaviruses typically don't have a really long life, meaning that there might be a chance that we might have to get booster vaccines for COVID vaccine, but more to come. So TBD, and we're learning more. Yep.
The people that were in those early trials, they've tested them, and most of them still have high levels of antibodies that they are so pretty successful so far, and that's 6 to 7 months for some of them.
Yep, you're exactly right. You know, with the last time, you know, they're kind of looking for those benchmark times. So first we saw like 3 months after getting vaccine or getting natural COVID infection, that you're probably protected within 3 months. And exactly right, Mary, as we're seeing more time pass, we're starting to have an understanding of how long that immunity lasts. So we shall see. Any other questions or comments on this?
On the topic of immunity, I was reading about breakthrough cases.
Mm-hmm.
And I wonder if that'll come up in some of our conversations. You know, I know that in most cases, doesn't really cause much illness at all. There have been around 500 deaths to date post-vaccine, and I wonder how to address that.
So excellent question. So that kind of fits into that phase 4 that we're continuing to look for any signal that indicates that something was is maybe impacted or not impacted from the vaccine, right? So one of the things that the FDA looks very closely at is any significant side effects that they're starting to see themes of, or deaths or breakthrough cases. So when they're looking at breakthrough cases, the last that I heard of was in, I heard this a week ago, that Wisconsin only had 2 confirmed breakthrough cases. And it's really hard to check for breakthrough cases. The definition is kind of gray on that. And the reason is a lot of people, when they go to test for antibodies for COVID, it can be, sorry, let me think of how I want to say this. The antibody tests for COVID vaccine versus COVID infection are different. But sometimes when they're going to look and do a test to see if somebody has COVID, they don't know if that's from natural infection previously, from our body's mounted immune response. We're learning more about what that antibody response really looks like. So it's really hard to say, like, are these true breakthrough cases? I mean, like, no vaccine is 100% effective, right? Like, that's a perfect world that would never happen. But we also kind of need to approach breakthrough cases with like a little bit of skepticism. Like, I think sometimes we also forget, like, there's other diseases like the common cold and the flu and things like that, that have really essentially stopped for the past year. And now as things are starting to open up, people are starting to get sick again. So again, are they really breakthrough cases? Some of them are confirmed, but it's tending to be far fewer than they're thinking. The other thing too with breakthrough cases is that the same with all vaccines, right? Again, because no vaccine is 100% effective, that even if you were to get coronavirus after, like within that really small window, that you would have a less severe case. All vaccines were 100% effective at preventing severe morbidity and mortality, so severe sickness and death. So it usually is like if there's a death that occurs from a breakthrough case, it's usually from something else that's also impacting the situation. And the FDA goes through and reviews very thoroughly each and every one of those cases. The ACIP, the Advisory Committee on Immunization Practices, they have been getting monthly reports, and I've actually been on some of the meetings where they read through the case, how it presented, what happened with it, and they're usually very, very complicated. So it's more than just like they got vaccine, it was a healthy person, then they died from a COVID breakthrough infection. It might have been cancer, it might have been something else. Yes, that was another long-winded response, but yeah, so hope that answered it though.
That was helpful. And it also answered a question that was in the news today, is the CDC has decided to only study severe cases rather than mild breakthrough cases. So
Yes.
I understand that clarifies that too.
Cool. Awesome that I was able to get both of them. Any other questions on this immunity, breakthrough cases sort of situation? Hey, do I still need to wear a mask after getting a vaccine? Today is a great day to do this presentation, I realize. Oh, go ahead. Oh, I don't know, somebody said something, but as of today, in Dane County, in accordance with CDC guidance, all orders for masks have been lifted. So if you are fully vaccinated, so again, what that means is 2 weeks after your first dose of Johnson & Johnson or your second dose of Pfizer or Moderna, you're considered fully vaccinated and don't need to mask. There are, though, exceptions. Businesses are still able to enforce if they want people to mask within their establishment. That is their own jurisdiction within a business or organization. Excuse me, that if they do want to keep masking within there, that they can essentially make their patrons mask. However, otherwise you don't need to mask any longer. So you might start to see signs that say, like, if you're fully vaccinated, masking is optional on doors. I've already started to see some of those. So yes, it's a good question. I think the other thing though too is masking and vaccines and physical distancing of 6 feet. These have all been tools in our toolbox that we would not have been able to get to this point in the pandemic without all of them, right? COVID vaccines has obviously very much helped, but it's been, I think people get into a little bit of, I think that masks have gotten very political. And what basically has happened is they've been one tool to help us get out of the pandemic. So framing it that way. So yay, yippee, I should like rip mine off, but I'm at public health, so I'm gonna keep mine on. Any other questions on this one? Cool. All right, so this is another one that I briefly mentioned earlier. Will the vaccine change my DNA? What's the answer?
No.
Yeah, no, it will not change your DNA. It teaches your cells how to fight COVID. Again, even with the mRNA vaccines, no vaccine components ever enters the nucleus of the cell. The nucleus of the cell is where DNA is kept. It's really hard to change your DNA if they don't ever even interact. So again, you can't get COVID from the vaccine, and the vaccine will never change the DNA. Cool. Short and simple. Questions on that one? Awesome. Are the current vaccines effective against the new strains? So before I hop into this question, I don't know if folks saw the news that in an effort, again, to decrease stigma, about what countries these strains are coming from. You might have seen that in the news that they have changed the strains to Greek letters. For example, I'll say it just for clarification purposes, the UK variant is known as coronavirus alpha strain. I think the South Africa variant is the beta strain, in that sort of fashion. So if you start, in addition, they're also trying not to call it like strain B117, because that's not super like health literate for most people, right? People are like, that is a lot of numbers and letters. I don't know what any of them mean. So you might start to hear those. And I think it's helpful to, if you do hear people continuing to say like, well, I don't want the India strain, to kind of like call people's attention to that, because when you hear that, that creates a lot of stigma, right? Like, I don't want to be calling out a certain group of people or a certain country because of something that's natural, right? So that's the first thing I wanted to say about that. But then question for you all, are the current vaccines effective against the new strains? Bless you, Bonnie.
Maybe.
Maybe. Yes. So it's kind of an interesting question. So as of now, all the vaccines that we have authorized in the US seem to be very effective against the new strains, which is great. However, we know that virus mutations are common. So we're continuing, and researchers are continuing to study the effectiveness of the vaccines on different strains. Another thing about strains, the different strains, is that when Johnson & Johnson vaccine first came out, you heard, oh, it only is 60% effective or things like that, right? Did anybody hear that? Like, I want a Pfizer because it's 95% effective versus Johnson & Johnson. Well, if you think about the timing of when vaccines were rolled out and which countries they were doing the clinical trials in, when Johnson & Johnson was really in their clinical trials, that's when these strains were circulating. So the J&J vaccine was actually able to do more robust testing of how effective their vaccine was on different strains, because they were able to just incorporate it in other clinical trials. Moderna and Pfizer couldn't do that. And so they're continuing in phase 4 to see, how effective it is against different strains. But when you hear that question about vaccine effectiveness, there are so many aspects that go into that. It's more than just like, this was 95, this was 60 or whatever. It has to do with different strains, different countries it was tested in, all those sorts of things. Questions on this one? Okay. So this is a really big one. Sorry, I just want to keep an eye on the time. Oh, sorry, we're a little bit over. We're almost done. I hope that's okay and everyone's able to hang out for another minute or so. So I heard the J&J vaccine was paused. How can I be sure this vaccine is safe? So I'll kind of talk through this one. This is kind of easier than a yes or no question. So on April 23rd, the CDC and FDA recommended that the use of J&J or Janssen be paused. The reason why they wanted that pause to happen was out of an abundance of caution, so that we could learn more about known and potential benefits versus known and potential risks for the vaccine. It was, I think, very important to note that at the time that they paused the clinical trial, 7 cases out of 7 million doses given was all that they saw of this very rare side effect that is a combination of blood clots and thrombocytopenia, which basically means low platelet count. So those two things together are a little bit of a contradictory statement, because blood clots have to do with our platelets kind of clotting blood, right? And making that clot in our veins. But thrombocytopenia, or low platelet count, seems to have, like, why would things be clotting if we don't have enough of those to clot the blood? So it is a very weird and rare thing that they're learning about. For them to have stopped giving out millions of COVID vaccine doses because of 7 cases shows how seriously they take the safety of this vaccine and of our communities, right? So they paused it. They did a lot of research. Again, they went through and did a case review of each and every one of those blood clots and thrombocytopenia. And the conclusion that they came to is that everyone can continue to get the vaccine because the risk is very low, but that women younger than 50 should be aware of this very, very rare risk of blood clots with low platelets. There is something to be said about like the association between those two. One of the things that they talked a lot about also was that, you know, with females anyways, with like birth control, there's already a higher risk of blood clots. And so there has to do something with circulating estrogen that people with circulating estrogen are just at higher risk for this. Again, they're extremely rare. By the time the pause was lifted, they found 24 cases out of 9.5 million doses given. So again, extremely rare, but is something that has come up. So the pause also allowed the CDC to communicate with healthcare providers and then re-emphasizing the importance of reporting severe events in people that have gotten the vaccine. It also allowed them time to carefully review all of the data and conduct a really thorough risk benefit analysis. So again, it just shows how important safety is to the FDA and the CDC. Questions on that?
It
Okay.
also, as I recall, it also gave them time to figure out a contraindication or a contra treatment, because people would treat what they saw. Health providers would treat the symptoms, which was not what should have happened.
That is yes, that's exactly correct. So usually with blood clots, you treat that with heparin. That's a medication to break up those blood clots. In this very rare condition, heparin actually exacerbates or makes the issue worse, which is really weird. And so you're exactly correct, Mary, that this was also time to communicate to all ERs, urgent cares, hospitals, that if you see a female or somebody with circulating estrogen, probably between the ages of 20 and 50 that recently had a COVID vaccine, and they have a clot, don't give heparin right away. So allowed them time to educate on the proper way of treating it. Yeah, so exactly correct.
Okay. So even if someone would have that reaction, health providers now know exactly how to treat.
Correct. Yep. And they're acutely looking for that now and reporting at each and every small thing that's even remotely close to it.
Great.
Yeah. Awesome questions. Okay. Just a few more questions. These ones are quick. Sorry that we're over time. Should I get the vaccine if I already had COVID infection? What's the answer? Yes, you should get vaccinated, even if you already had COVID. We don't know how long people are protected from natural immunity. So it's really important to get that vaccine, even after recovering from COVID. Another question that we're hearing a lot, specifically in the Black and Latinx communities, is will COVID-19 vaccine affect my fertility? Some of this is rooted in a false report that surfaced on social media saying that the spike protein on the coronavirus was the same as another one that's involved in the growth and attachment of the placenta. But part of this is also having to do with experimentation and medical racism that has been done in the past on these Black and Brown communities. So, you know, there's been a lot of testing on the Black and Latinx communities in the past for birth control and things like that. So again, it's really important to, one, recognize the harms that have happened in the past because of this, and that this is a legitimate fear. However, no, getting the COVID vaccine will not impact your fertility. Again, like I told you guys earlier, the COVID vaccines break down pretty quickly once they're in the body. So it doesn't have that effect. And there's no reason to delay pregnancy because of getting a vaccine. Similarly, and the last one I believe is if I'm pregnant or breastfeeding, can I get the vaccine? The answer is yes. You can still get the COVID vaccine if you're pregnant or breastfeeding. Like I just said, COVID vaccine breaks down really quickly once it's in the body and degrades pretty quickly. The American Gynecology and Obstetrics Society, they have fully recommended the vaccine. It's always helpful to have a conversation with a healthcare provider if you're feeling like you have some hesitations and you're pregnant or breastfeeding. But in terms of gynecologists, obstetrics, all of those, CDC, FDA, that you can get the vaccine if you're pregnant or breastfeeding. All of that being said, it is totally normal to have questions about COVID vaccines. I think that's a really important thing, is that a lot of times I think we tend to make people feel like they can't ask questions because, again, they're silly questions. Our job, I always say very, very clearly, my job as an immunization coordinator is never to make someone get a vaccine. That's not my job. My job is to listen and provide reliable information. So just go into your conversations with that mentality and know what reliable sources are out there, right? Again, this may come as a surprise. Facebook is not a reliable source. I'm very sorry. That's breaking anybody's heart. CDC obviously has some great information and some really great FAQs, some documents. Our website, publichealthmadisondanecounty.com. Mayo Clinic also has some really good health literate resources. Immunize.org, that's the Immunization Action Coalition. And then the Department of Health Services at wisconsin.gov. All places that you can go and refer people for reliable information if they have questions. Yes, and I apologize again for going over a little. Any last questions that folks have? Comments?
Thank you, Tess.
Yeah, I hope it was
Thank you.
helpful. I'm always available. My email's there. Feel free to reach out to me if you have specific questions. I live next to my work phone, which sometimes I wish wasn't the case. But if you guys are out and about, feel free to shoot me an email if you hear a specific question. Anytime that we get questions from people, it just helps us understand more about what the fears are. So again, very, very grateful for all of you, A, doing the work, and B, being here today.
Thank you, Tess. Thank you so much. This was incredibly helpful. I want to just remind you all, look for the Sign Up Genius. It'll come out probably tomorrow. I'm just going to do a little bit of editing on it. Except for the Urban League event, none of this is time specific. It's when you have time and availability to do it. The last question is, how do I get the flyers? Rebecca is Worker Justice Wisconsin is making the flyers. So I'm going to turn that over to Rebecca to let people know how they can get flyers from her.
So I'm looking at everybody who is presently at the call, and most people are associated with Worker Justice Wisconsin. So you know where to get those. We can also, so you can come to the office is what I'm saying, or you can tell us where to mail them to you. I suppose for everybody listening on this recorded, the same thing. You can come to our office at 1602 South Park Street. Just email me before so I know to be there or to make sure that somebody is there when you come, or tell us how many flyers you need and we can mail them to you. Bonnie, if you want to also be a place where people can go to get flyers, I can also provide a chunk of flyers to you.
Yeah, sure. That would be great. And Rebecca's email is easy to remember. It's just rebecca@workerjustice.org. All right. Great. Thank you all so much. Thank you for taking the time tonight. And thank you so much for volunteering for this project. We literally cannot do it without you. So we really appreciate your taking this on. And we will be in touch. Thank you all. And thank you, Tess, again.
Thank you.
Thank you so much.
Thank you. Have a great night.
information. All right. Bye-bye.
Good night.